What does a rat first identified in Nigeria 57 years ago have to do with hundreds of deaths every dry season? This is a mastomys rat, the natural reservoir of Lassa fever, an acute viral hemorrhagic illness, first discovered in 1969 in what is now Borno State.
Nigeria Center for Disease Control has reported 21 new confirmed cases and 5 deaths of Lassa fever in the last week of December.
The rat itself is not deadly. Humans and rodents have coexisted for centuries. Lassa fever still kills in Nigeria every single year. In the 2026 dry season, so far, Nigeria has reported thousands of suspected cases and hundreds of confirmed infections with dozens of deaths. Early 2026 figures include 1,469 suspected cases and 318 confirmed infections with at least 70 deaths among them. Case fatality rate estimates suggest a fatality rate above 20% in this period, significantly higher than typical global averages for Lassa fever. These data come from weekly epidemiological situation updates during the dry season when Lassa outbreaks peak. In 2025, Nigeria recorded over 1,148 confirmed cases and 215 deaths for a case fatality rate around 18.7%, up from the year before. Fatality rates in 2025 were higher than in 2024, signaling a stubbornly deadly trend across multiple states. These deaths are rising under the current administration, not because the virus has changed, but because the system has. Here is what is behind the crisis. Number 1, environmental risk is structural. Lassa virus spills over when rodents contaminate food, water, or surfaces with infected urine or feces. These rats thrive where waste management is poor, food is exposed, and housing is rodent-prone everyday realities in many Nigerian communities. Global evidence shows that better sanitation, rodent control, and safer housing cuts Lassa transmission, but these interventions are neither scaled, funded, or monitored consistently in Nigeria. Number 2, surveillance is weak. Laboratories in Nigeria are under-resourced. Contact tracing is inconsistent and data rarely flows efficiently from local clinics to federal authorities. Outbreaks are spotted way too late and responses lag. Number 3, healthcare response is not prepared. Hospitals treat seasonal peaks as emergencies rather than maintaining year-round readiness. Protective gear is inconsistent, and ribavirin, an antiviral that can reduce mortality when given early, is often unavailable where it is needed. In countries with strong early detection and response systems, Lassa fatality rates rarely exceed 10%. Nigeria's higher figures reflect system weakness, not a more virulent virus. Number 4, health security infrastructure is siloed. Environmental management, hygiene services, housing policies, community education, emergency logistics, and laboratory networks do not integrate. Sanitation services are underfunded, awareness campaigns are sporadic, and primary care facilities are not empowered as epidemic detection posts. Predictable biological risks become recurring catastrophe. And lastly, number 5, poverty and hygiene gaps amplify risk. Poor water sanitation and hygiene coverage, unsafe food storage, and low-income rodent-prone housing makes exposure almost inevitable. Now, here's what we know. The World Health Organization and UNICEF consistently link poor water sanitation and hygiene with higher burdens of rodent-borne and water-associated disease. But these interventions are not prioritized in Nigeria's health planning. 57 years after Lassa was first identified, it still kills Nigeria because Nigeria treats it as a predictable disease and as a seasonal emergency instead of a public health security issue. Predictable outbreaks, underfunded hospitals, weak surveillance, and fragmented systems have pushed fatality rates higher, and that is a moral indictment of governance. This is not a medical mystery, it is political. Every infection, every death, every under-resourced hospital tells the same story. Nigeria has abandoned its citizens to the rats. Nearly 6 decades later, Nigeria's Lassa crisis is a governance catastrophe, preventable deaths caused not by virus but by structural failure and neglect.